Yes, I definitely think calling it a cure-all is misleading, and I wish it was, because it's actually a very inexpensive vitamin that's easy to get through prescription. So you
Yeah.
know that it's regulated since you get it from a pharmacy. And it would be wonderful if we could just give it to everybody for all different reasons and it fixed everything. I think, we're learning a lot more about methylation and the methyl pathways. And leucovorin is folinic acid, which is an important vitamin that your brain needs. And in some kids with neurodevelopmental issues, not just autism, but others as well, there are things called folate receptor autoantibodies, and that sort of makes it so your brain doesn't get enough folinic acid. So by giving folinic acid, it can go straight into the brain where it's needed to be. And in some kids with autism, and we have some studies that show this, it can help either mildly or even dramatically with increased language, help with behavioral issues.
A big reason, Anshu, that parents latch onto these headlines is because autism doesn't have one clear, concrete cause. And then when something feels uncertain, it leaves the door wide open for speculation and even conspiracy theories to take hold, right? Like, well, because it's such a varied spectrum, because we don't have a reason, let's say that this is what causes it: Tylenol, acetaminophen, vaccines. So from your perspective, what do we actually know about autism, and why is it so hard to get a clear answer from research on like the pinpoint cause?
I feel like over the last 40 to 50 years, we've learned so much about autism, but the more and more we learn, I realize how little we know.
Yeah.
And that's why it's so important now to continue to look at other factors. We do know genetics plays the largest role. Autism is a very complex neurodevelopmental disorder, and we don't have a single cause. That's the problem. It's not like, cystic fibrosis. Well, we know the gene that causes it, right? It's thought to be multifactorial. So many factors can play a role in the development of autism. Genetics plays a really a significant role in this. I call it the genetic salt shaker. It's the genetic salt shaker. Mom and dad combination of genes probably plays the biggest role.
Hello and welcome back to the PedsDocTalk podcast. I'm Dr. Mona, your host. And before we dive in, I want to thank you for being here. Whether you're a longtime listener or new to the show, every download, review, and share means so much. And if you are tuning in, you are watching this on our YouTube channel, which means that in order to help the show grow, you need to hit subscribe. You need to share this episode. And remember, this channel has more than just podcasts. It has educational content as well. And one of my favorite things about the podcast is not only do I do things on child health, development, and parenting, I'm able to connect with experts around the world and in the United States as well to talk about current events. And recently there was a press conference by our government in the United States, including the president, talking about Tylenol, acetaminophen, the generic name, autism, as well as leucovorin. And I had a lot of questions flooding in, a lot of misinformation flooding in. So I went to my community, to my colleagues, to find two expert guests to chat with me today on this topic. We are talking about autism. Is Tylenol to blame? Is leucovorin the answer? A conversation with a fellow pediatrician and developmental behavioral pediatrician. And to help unpack this, I'm joined by two incredible doctors. First, Dr. Tanya Altmann, pediatrician, founder of Calabasas Pediatrics Wellness Center, editor-in-chief of the American Academy of Pediatrics book, Caring for Your Baby and Young Child Birth to Age 3, and a mom of 3. And next, we have Dr. Anshu Batra, a board-certified developmental pediatrician who earned her medical degree from the University of Michigan and completed her pediatrics training at UNC Chapel Hill, based in West LA. She has over 30 years of experience caring for children with neurodevelopmental disorders, including autism, ADHD, learning disabilities, cerebral palsy, Fragile X, and other genetic or behavioral conditions. And her practice centers on a personalized approach that builds on each child's strength to help them reach their full potential. And she's passionate and also a proud mom of 3 adult sons, one on the autism spectrum, and a passionate advocate for individuals and families living with developmental disabilities. And needless to say, I think I got 2 amazing people to join me in this conversation. Thank you both for joining me today.
Thank you for having us.
Yeah. And, I wanted to jump right in. Of course, a brief introduction for both of you. I did already. But, obviously you can weave in your experience as we talk in this conversation. But I'm going to ask you, Anshu, first. There's been a lot of chatter after the administration's press conference suggesting a link between acetaminophen use in pregnancy and autism. And parents are confused, and some are even scared to use acetaminophen now. From the research we have, is there evidence that acetaminophen in pregnancy or even after pregnancy for children can cause autism, and how should parents interpret these reports and results?
Well, the first thing I want to be very clear to the audience is the short answer, no.
Mm-hmm.
That there's not any strong evidence that Tylenol or acetaminophen causes autism. There are several observational studies that were done that reported some small associations between the use of acetaminophen in pregnant women and neurodevelopmental disorders. But these studies don't prove any cause or effect. It's basically confusing a correlation with cause. It'd be like saying if you see a meteor shower and you have a heart attack, that meteor showers cause heart attacks.
Right.
It's very important to know that the cause can't be identified based on these observational studies. And there was also studies that were done comparing siblings in an effort to control environmental factors, genetic factors, and those studies didn't show any direct link or correlation. So I think it's really important to highlight that no, Tylenol is not a cause for the increased risk for autism. And I think that that's an important thing to share with your audience.
And for you, Tanya, as a practicing pediatrician right now, have you had conversations with your family, maybe even after this conference or before, about this misconception or other misconceptions when it comes to autism and the causes that people assume that could be the reason?
Yeah, I mean, I think it's hard because we don't know exactly what causes autism. And I just got back actually from an autism conference 2 weeks ago where there was a lot of data presented on genomics. So
Hmm.
gene variants, which are called SNPs, and many of them are de novo, which means they just appear in a developing baby. It doesn't mean they're passed on from mom or dad. And the interaction between many environmental factors, whether it's medication, whether it's fever, whether it's illness, and different trends that they're seeing that may go on to cause neurodevelopmental issues in a developing baby. And I think there's still a lot of research that needs to be done. It's kind of how we used to say things were multifactorial, right? When we were in medical school, it means a lot of
Yeah.
different factors can go in to causing this. And so I do hope we'll have more research soon to really look into this. There's also some great research out of Mount Sinai. There's a Dr. Manish Arora who's been studying biomarkers in infant hair and basically linking that with pretty good accuracy to determine which babies are at risk for autism. And then the question is, what can we do? Are there environmental things that we can do to maybe help with their development?
This is why I was so excited to have you both on, because I wanted to kind of hear the updates in, autism research and learning about like the genetic testing, the hair samples. I mean, that is really cool. Is there anything else you want to add to that, Tanya, about what you've learned at these conferences that you think is useful for the public to know, or how maybe you've incorporated it into your practice when it comes to diagnostic criteria or diagnosing autism?
Yeah, I mean, I think, as a general pediatrician, everyone asks me how I got into seeing kids with autism, PANS, PANDAS, whatever it is. And I
Yeah.
say, I learned from my patients. So I've been practicing for 25 years now. And when patients come to me with things we can't figure out or questions, or they're maybe not doing well in standard treatment, that's when I kind of take that time to really go out and find conferences and experts to learn more. And that's one of the great things about medicine is it's as much of an art as a science. And so I've learned everything that I know over the years to help, different families as they need it. That's also where I learned about Leucovorin, which I think we're going to talk about next.
Yeah. And A big reason, Anshu, that parents latch onto these headlines is because autism doesn't have one clear, concrete cause. And then when something feels uncertain, it leaves the door wide open for speculation and even conspiracy theories to take hold, right? Like, well, because it's such a varied spectrum, because we don't have a reason, let's say that this is what causes it: Tylenol, acetaminophen, vaccines. So, from your perspective, what do we actually know about autism? If you want to add anything else to what Tanya said, and why is it so hard to get a clear answer from research on like the pinpoint cause?
The reason this is such a difficult and confusing topic is because autism is a very complex neurodevelopmental disorder, and we don't have a single cause. That's the problem. It's not like
Yeah.
cystic fibrosis where we know the gene that causes it, right? And as Tanya mentioned, it's a multifactorial. It's thought to be multifactorial. So many factors can play a role in the development of autism, and what we do know is that genetics plays a really a significant role in this. I call it the genetic salt shaker. It's the
Yeah.
genetic salt shaker. Mom and dad combination of genes probably plays the biggest role. And then what we also know and what we're trying to figure out now is what are the other factors that play a role in terms of the environmental factors. Is it toxins? Is it viruses, right? Is it certain medications? Is it a combination of everything that then can set up a vulnerable neurobiology, which then derails development? And I think that's why it's so hard, and that's why it's so confusing. It's so complex, and what we it's so interesting. I think about this that I feel like over the last 40 to 50 years we've learned so much about autism, but the more and more we learn, I feel I realize how little we know.
Yeah.
And that's why it's so important now to continue to look at other factors, and so we do know genetics plays the largest role, and then we know that there's other factors like maternal age, paternal age.
Yes.
We know pollution. We know there's certain toxins, certain exposures to certain infections, especially early on in the first trimester, right? And prematurity. We know that there's certain factors that increase the risk of autism, but there's no one single cause, and that's why there's such confusion. That's why it's so hard. That's why the goalpost keeps moving.
Yeah.
And that's why it's so hard for our parents who are so confused, because there's so much information out there. There's so much misinformation out there, which is why I'm so glad that people like you and Tanya and I are here to hopefully help clarify things and help guide parents into having a little more information, and hopefully be able to identify and treat early. That's the other thing I was going to say, is that one of the key factors that we do know is that early identification is important, or early intervention is important. And I know Tanya sees the little ones, and she refers them to me, and I love when I get the babies, and I love when I get the 15-month-olds. They're the ones that you can see quicker or more rapid improvement in development. So again, that's what I think. That's why it's so confusing, I think, for families and for the public, is because it's not one single cause.
Yeah, and I think because of that, I think the messaging has to be such that we talk about, benefit, risk, and what we do know. Even talking about acetaminophen, the sibling study that you alluded to. And if anyone wants more about all of the studies, I've deep dived in them in my YouTube, my newsletter. I've done a whole analysis on all the studies. But it is more of understanding. Hey, here's what we know now. Does the biochemical or pathophysiology, like, does this make sense? Like, when we think about it as, clinicians, as a cause or as a exacerbator of symptoms of like people are often talking about ADHD as well, like red dye and things like that. Like we have to think about not being so black and white in how we educate, but also in terms of being open, like you are, Tanya, to going to the conferences, learning from other educators on like, is there something innovative? I love that you talked about the genetic testing and almost like the hair testing, because like I've also become very interested in like genome and exome testing. And like you said, is testing going to change the outcome? Like it's not, a lot of people used to genetically test for Down syndrome, and there was a lot of controversy behind that because now we see a lot of families who are like very pro, Down syndrome advocacy. It's like, if you knew that your child had autism, is it going to change anything, or is it going to mean earlier intervention, right? Which is what we all are hoping for. And so there's a lot of like things up in the air of like, if we actually can test, if we have a genetic marker, what are we going to do with that information? And I think that is why I was excited about the conference, because it started this discussion in a mainstream way of like, hey, autism is here. What can we look into? I just hope that I wish it wasn't as filled with like absolutes and misinformation, because that can confuse a lot of people.
Yeah, and I think that's the biggest thing is that there are no absolutes.
Mm-hmm.
You mentioned genomics. I've started doing some genomics testing on my
Mm,
patients, and usually the ones that want it are the ones that have neurodevelopmental issues or they have a sibling with neurodevelopmental issues. And when you look at all the genetics and you'll see all the SNPs, so what it does is identifies the rare variants, which might be why your child reacts differently to different environmental triggers. It still is very confusing because not everybody responds the same. I mean, think about the MTHFR gene, for example, which I think has gotten a bad rap for a lot of the things that we see. Many of us that are homozygous for MTHFR don't have any of the issues that people are reporting, yet some are more sensitive. And so I think there's, each gene can respond differently to different environmental triggers. And that's what makes this so complex and so hard, especially when you're talking about our country as a whole. It would be amazing if we could do individualized, personalized medicine for everybody in our country. And I think we're getting closer, but it's also
yeah.
challenging because there's so many of us.
Oh, absolutely. And that's exactly it. And that because this is such a multifactorial situation and that there's so many factors even in the genetics of it all, it's really hard to say it's one size fits all. And I appreciate that.
Back in the day when when I was training, the extent of genetic testing was really doing uh, karyotypes, which was really just
Yes.
which was really just looking to see the number of chromosomes for trisomy 21, for example, right, for Down syndrome, right. But over the last, I would say, 30 years, the innovation in genetics has really increased to now we're not only able to see the number of chromosomes, but also the deletions and duplications, like what Tanya was mentioning, as well as now we're able to actually see like misspelled words, in a chapter book, if you think, which
Right.
are the genetic variants that we're talking about, and then seeing what the associations are with that, and neurodevelopmental disorders,
Yeah.
or other medical conditions. So so I think the genetic testing is an important piece to this, along with the other sort of treatment modalities that we're going to be talking about.
And I'm excited to stay in touch with you all. Like, as you learn more, I can learn more, in case I don't get that information. Like, it's a superhero effort of like going to the conferences and learning from others and sharing that information. Because, like you said, Tanya, it's not as mainstream for a lot of our other Gen Peds colleagues to know this stuff, right? And so it's really nice that we can do that. And, my next question is talking about that leucovorin, So, Tanya, this question is for you. The press conference presented leucovorin almost like it's a cure families can just ask for at the doctor's office and that you should get it. Like it wasn't like nuance, which I think it should be. So since both of you actually prescribe leucovorin, Tanya, do you think you can explain what it really is, what role it can play, and whether calling it a cure-all is misleading?
Yes, I definitely think calling it a cure-all is misleading, and I wish it was because it's actually a very inexpensive vitamin that's easy to get through prescription. So you
Yeah.
know that it's regulated since you get it from a pharmacy. And it would be wonderful if we could just give it to everybody for all different reasons and it fixed everything. I think, we're learning a lot more about methylation and the methyl pathways. And leucovorin is folinic acid, which is an important vitamin that your brain needs. And in some kids with neurodevelopmental issues, not just autism, but others as well, there are things called folate receptor autoantibodies. And that sort of makes it so your brain doesn't get enough folinic acid. So by giving folinic acid, it can go straight into the brain where it's needed to be. And in some kids with autism, and we have some studies that show this, it can help either mildly or even dramatically with increased language, help with behavioral issues. And I have seen that in some cases in my office, but not in every case.
Right.
Now, there is testing you could do to see if a child has the folate receptor autoantibodies. It's called the FRAT test, but it's an expensive test. It's a venipuncture, which means it's a poke. And often in some of these little guys, the toddlers, we don't always want to poke them as that's traumatic and hard to do. And the test takes 4 to 6 weeks. And I've actually talked to the researchers at the lab, and I think it's a fascinating test. And I'm so glad it's available when needed, but it's just not yet available for everybody. So the question is, do you need to test everyone to do a trial on leucovorin? And I think that's very debated. I've tested a few of my patients, but others I've just started on the leucovorin. So how do I start it? I start with 5 milligrams a day, and I write the prescription. Usually it's covered by insurance. It's a tablet, so you can crush it though and mix it with anything the child's eating. It doesn't taste bad. And just so you know, I do taste every medication I prescribe for my patients because with kids, taste matters so much.
What a good doctor. I do the same with when I get access to antibiotics, and things like that, if I can, I'm like, let's see what happens here. Yeah.
Exactly. And so you mix it into whatever they're eating. And then I usually increase it by 5 milligrams a week. And if you look at the studies, some of the studies go up to high doses, like 50 milligrams a day. I personally haven't gone higher than 30 milligrams a day in my patients. It's also weight dependent, and most of my patients tend to be younger, so that could be why. The really only side effect is that in some kids, it can cause hyperactivity. Now, I haven't quite figured out if the hyperactivity just happens in some kids or it happens in the kids that don't need it. Because I had one child with autism who was in first grade who ran around the classroom in circles when he was on the folinic acid. And I talked to many experts around the country, and some said stop it, some said decrease the dose. And so I talked to the parents about decreasing the dose or stopping it, but the parents actually didn't listen to me. They just kept giving it. And a week later, he stopped running around in circles, and they said his language actually improved a lot. So I was kind of glad they didn't listen to me. So I think it is variable, and it takes that time to sort of tinker with it and figure out if it is helpful. But I also find that it's not only folinic acid, but there's other B vitamins you want to supplement to also support the pathways. And then a lot of these kids, the ones that we do poke and get labs on or micronutrients, we do see that they're low in iron, they're low in zinc, they're low in a lot of other things. So again, it is wonderful when we can do personalized nutrition and supplement plans for everybody, but it's not always practical.
That's so fascinating. After the press conference and after, digesting the information, I myself don't prescribe leucovorin yet. I say yet because of course maybe I will in the future, and I wanted to learn from other of my colleagues like yourself. I asked my followers on my community, I have this large online community, and I said, hey, if any of you are willing and have had your child on leucovorin, do you mind just sharing your experience on this form? Obviously you don't have to put a name on there. I'm just curious. And I got about 20 responses, which is a lot in my opinion. And like you said, it was very mixed. The response that I got overall was that they felt like the benefit outweighed risk. Like no one felt like there was these awful side effects. And I'll ask if that was what you've seen in your practice. And then I did get that comment that the language explosion happened. Like for a lot of the people who felt like it did work, they said that it helped with language as the biggest thing. So I'm curious. I can ask you, Tanya, and then Anshu, if you also prescribe the leucovorin. Is that what you're seeing as well from your families who've used it, that the benefits have outweighed risk, and also the biggest benefit has been in language, language progression?
Yes, exactly. And I think there's very little risk to taking this vitamin. And we know, as with all B vitamins, sometimes it does cause kids to be energetic. Even if
Yeah.
I take too much B vitamins and drink my coffee in the morning, I can be a little, wired too. But I think in the patients that it helps, it dramatically helps. And the parents are so thankful. And so I
Mm.
think it's an easy thing to add in to see if it helps. Or you could pursue some of the testing to see if maybe your child would benefit from it.
And yeah.
So listen, there were a couple studies that were done over the last decade or so, looking at leucovorin and its effect on children with autism, and it definitely showed some improvement, especially in language development and speech and language, and in some of the social sort of socialization
Mhm.
or social skills improvement. And I think that in my experience, I've started using leucovorin. I like Tanya, and probably like the 20 other pediatricians that responded to you, and finding sort of a mixed bag here. When it works, it works.
Mm.
When I would say most of the time it's been meh. It's been
Yeah.
sort of a sort of unequivocal, but I would say that I've had cases where I've seen parents have reported improvement in language, improvement in ability to self-regulate, improvement in interest in socialization. And I see young as well as older, young adult individuals as well. And also, I'll use the higher doses. I might start at 5 milligrams, like Tanya does, and ramp it up pretty quickly to the higher doses of maybe up to anywhere from 25 to 50 milligrams, based on what the study showed. And like I said, I think the benefits outweigh the risks. And so I just tend to start it without doing any blood test, without doing the frat test, because it's expensive. It's a blood test. Very often our patients don't like needles. And so I talk to the parents, and if they agree and they want to move forward, then we do it. And like I said, it when it works, it works. And I think that's what's made me more willing to try
Yeah.
than not try. At least it's something that we have to offer, and even if it moves the needle a little bit, it's worth it. The side effects, as Tanya mentioned, are what I've seen. I've had a few kiddos, especially the younger ones, tend to have more of the irritability, impulsivity, and I'll lower the dose or take it off.
And, so I totally respect the fact that we're not checking blood work on everybody because of the cost and the invasiveness of having to do a venipuncture. So, like a official blood draw. So, is there like a certain type of patient candidate, maybe the level of the autism, or is it been that also just the parents have asked for it and there's just a mutual decision making? Or do you guys have your own personal criteria on when you say, you know what? I'm not checking blood work, but this is a type of patient that I think is going to benefit from this treatment approach. And Tanya, if you want to start first.
Sure. I think it's something that I bring up with all my families.
Mhm.
I do a lot of detailed nutrition intakes in my office too. And a lot of these kids are pickier, right? They
Yeah.
might eat just a beige diet. And so I've worked with a lot of different supplements over the years. I really like micronutrients in these kids also. I think many of them need a really good micronutrient vitamin. And so it's just something that I discuss along with everything else. And most of my families want to try it. And we try it. And I have
I
to
love it.
say that I've also tried it in other neurodevelopmental disorders that are not autism diagnoses.
I agree. I mean, in general, doing blood work is part of my workup. But again, as we're talking about children who may be averse to having a blood draw, we might wait. But in general, as Tanya mentioned, that's part of the standard workup for me is to do blood work, looking at common things such as thyroid and iron levels, and some of the other micronutrients that she mentioned, but also looking at some of the mitochondrial cofactors that can also play a role in the overall metabolism and function. So I think that's important. So again, even though we're talking about leucovorin here, and a folate supplement, I think the broader issue here is really looking at the overall metabolism and the overall sort of physiologic health of the child, and see what other factors can play a role in their development and behavior.
It is nice hearing clinicians talk about this, and I think our listeners are going to really appreciate that. Any child that we approach, looking at it as not just like, okay, it's neurodevelopmental, it's just genetic, that's what you have to deal with, but what else can we do to support everything, right? I mean, I think we all agree here how much nutrition can impact every part of our life, right? I also am a big believer, and I think, Tanya, I believe you are the same in gut health. Like, I'm
Yes.
really interested in gut health, and I think, Anshu, you are too, like as well, and like how that, where's that connection there? Not that we're saying that your lack of doing this is causing the autism or causing this, but can we support the child so that symptoms aren't as severe, or that maybe, like you said, you guys are both checking nutrient profiles. Have either of you found, and maybe Tanya, you can answer this first, barriers in getting those labs done, or cost issues? Obviously, because we know that this is not standard protocol, right? Like, this is not like, okay, every pediatrician should be checking this. Have you had any barriers in getting these tests done? And I'm talking just like basic nutrient profiles or anything like that, for your families.
Yeah, I mean, cost is always a factor because it's not all going to be covered under insurance.
Mm-hmm.
The micronutrient panel that I use is $199, which is a barrier for many, but I also feel like in the scheme of all the genetic testing, it's pretty affordable. So that's one that I like to use. But even just doing a basic ferritin, vitamin D, you can get a lot through basic blood work that can go with insurance. I am lucky in that one of my nurses is an amazing phlebotomist and draws on the little kids. And clearly, some of them still don't want the blood work, but that's helped so much to not have to send my patients out to the
Mm,
labs.
I love that. And what about for you, Anshu?
Yeah, I mean, I think cost is always a barrier for, I think, for most people, and I'm very mindful of that. But I think parents are willing to do what it takes very often. And like Tanya, a lot of the lab work initially, uh, hopefully, will be covered under insurance, and some that goes to outside labs will not be. And hopefully, the cost is something that the parents are willing to incur. And what I'm finding though is that these labs, for things like micronutrients and genetics and things like that, I'm finding as they're getting better and better, that they're actually more mindful of the cost, and so the price point tends to be a little bit more affordable. But again, I have that discussion with parents, and let them make the decision, and we work that way.
Yeah,
And
and
like,
I wanted to add,
yeah,
I was going to
no, go
say, I
ahead.
also want to add, there are a lot of different outside tests that we can do. And so I try to discuss with parents and be very mindful of, is this going to change what we're doing, right? So
Yeah.
yes, in some cases, I want to check their gut microbiome, but in other cases, I just want to give them a good probiotic. In some cases, I want to check their micronutrients, but in other cases, I just want them to take a really good multi-mineral vitamin every day. And so we kind of talk about the pros and cons, and maybe we wait on the testing and we just start some of the interventions that I think might be helpful. And then if we end up hitting a barrier, then we'll add in specific testing, because I also don't want to do all this testing that's not going to change what we're working on with the family.
Right. I mean, to add to that, for me, my standard protocol would be, I get all my kids on good brain fat, the omega
Nice.
3s, and even in sunny California, we have an epidemic of low vitamin D levels, and so I like to boost the vitamin D levels with extra vitamin D. I like to get all my kids on a good multivitamin. There's one that I think both Tanya and I use, but it's called Spectrum Needs. It's a powder form. You mix it in water, and it's a relatively okay taste, so kids will take it. And it provides a lot of the micronutrients that kids are not getting in the standard American diet. And then I also like to get my kids on a good probiotic, that hopefully they'll be willing to take. And so at least that's a good way to start. And then based on blood work and other lab work that we do, we can add add to that.
Yeah.
Oh, I love
And
my
I want to
podcast. I love my podcast because I learn so much from some of my guests sometimes, and this is one of those things. Like, I love this. It's just so nice to hear about what y'all are looking at. I mean, it's stuff that I would obviously consider as well, but having you all both do this on a regular basis, especially, not every pediatrician is going to do that. It's really nice. And I hope a lot of our listeners who may be clinicians are feeling more interested in learning about this. That is my hope from this conversation, that it's not only for parents, but it's also for parents now to be able to take this episode and conversation to their doctor and be like, hey, I'm interested in this. Like, is this something we can chat about? And if the doctor is not amenable or doesn't know what to do, they can learn about it, because that's how we get better for our patients. And so thank you. And Tanya, I know you were about to say something as well.
I was going to say that, the other thing I do is my regular healthy babies when they're born. So you don't know if they're going to develop autism
Yeah.
or anything, but I try to really start them early on with extra bifidobacteria for their gut. I add an omega, since you mentioned how important that was at 6 months of age. All my babies are on omegas. Vitamin D starting from birth. And depending on what they're feeding, I may add in other vitamins. And I know it's confusing because we want our kids to get their nutrition and vitamins from food, but we also know that they're just not. And so I do really try to front load all that good health and things that I think might help change the trajectory as they're getting older. And the one thing we also didn't mention was screen time. And I met with a pediatric neurologist a few weeks ago that's been doing research on how early screen time can also change some of the connectivity in your brain. And again, not cause autism, but might change the way kids develop and affect neurodevelopmental conditions a lot of different ways. So I think there's still so much we're learning, but so much education we can do as general pediatricians early on to really help our little ones be healthy and have a great long health span.
Fascinating. Oh my gosh. I mean, let me think about, obviously, again, I appreciate you saying that it's not causing it, but it's not helping situations. And of course, we have to take that nuanced approach that, yeah, if there's a lot of screen time happening, or is there a certain limit that we are causing this sort of rewiring to happen when the brain is so malleable? I mean, especially early screen time use for your younger kids. I think it's so fascinating. And I love that
Well,
we're opening
this
these
would be
thoughts.
another topic for another
Yeah.
podcast. But what Tanya's referring to is Jonathan Haidt's book called "The Anxious Generation."
Mm-hmm.
You should. I don't know if you've read that or not, but that's amazing. He's chronicled sort of over 30 years the change in society in terms of the the phones, the iPhones, and how then it's correlated with children's anxiety levels
Mm.
and social sort of social isolation issues, and it's just fascinating. So I know that's something that I
In
think we
Yeah,
all sort of
in his
caution and help.
in the book, does he go into the early, like, this connection of the ADHD, autism, neurodiversity connection with screens, or not, more so anxiety in teenage years?
Well, it's really more anxiety
Yeah.
and depression, especially in girls early
Yeah.
on, and it's also on socialization and social skills and lack of
Mm.
connection. And he talks really about and he correlates it really to the time in terms of
Yeah.
the early 2000s and the start of the iPhone and the rise over 10 years of anxiety and depression symptoms in adolescents, especially in girls.
Mhm.
But just fascinating. So I know our neurologists that we refer to very often will send this podcast that uh, really talks about Jonathan Hayden and his work, really cautioning parents about early uses of the iPhone and iPad for their children, really limiting screen time.
Yeah.
And really talking
No, I
about
think
more, just common sense things like, going outside and playing
yeah.
and turning off your phones and having more, interactional time, as a family, and just things that are common sense that
Yeah.
now we have to kind of prescribe.
Yeah, the
And I was
basics.
talking about research going on at Cedars-Sinai here in Los Angeles about the younger kids and neurodevelopmental issues. And they're doing a 10-year study. And I think they just published their data halfway through. So we're going to be learning more and more also on the effects of screen time in those younger kids.
So fascinating. I cannot wait to read more about this. Like I said, it's so important for us to stay up to date. That is part of practicing medicine. And, one of my biggest questions for both of you is we're talking about all of this, right? The research, whether it's about genetic testing, making that more accessible, evaluations. From your perspective, what kind of research is still needed to better understand autism? Whether we're talking about possible causes or supportive therapies, and where do you wish more funding or more resources or education would go into when we talk about autism? In your dream crystal ball, I want this magic wand world, where do you wish more things, more resources can go when we think about autism? And I'll start with you, Anshu.
Wow, this is a great question. This is my wish, right? So I
Yeah.
think very important question. As I said before, we've learned a lot about autism over the last few decades, but we know so little, and research is essential that we do to learn more about the genetics of autism, but actually not only the genetics, but the environmental factors that play a role. And so really from my standpoint, what I would love and what we really need is really more research looking at the subtypes of autism, because that's really what we're seeing in my practice over 30 years. I've developed an approach to be able to really look at children with autism and be able to almost subtype them. And based on that, then it allows us to better develop a program to help treat and improve those symptoms. And so that's really what's critical, is we need to have better research to subtype autism. I think we need to be doing research to look at treatments, and a lot of the treatments that we're doing in the community that we're actually doing off label.
Yeah.
And I know Tanya and I would love to have more research to help support us in what we're recommending to our patients. There's a lot out there that people are doing. There's a lot out there that we are looking at. As I say that I look under. I never say no to anything. I look at what's out there. I look at the research out there. I look at and see what it might be doing. And again, we're all physicians. We all took an oath to do no harm. So that's our first task here, is to do no harm. But then to really look at things critically and see what is it, and what profile of patient is it that could maybe be benefited from this intervention versus something else. And I think that's what I do. That's what I feel like I do. I know that's what Tanya does. It's not a one size fits all. It's very personalized and individualized based on the presentation of the patient, what their strengths are, what their challenges are. And really that's what we need to do, is really help to identify treatments in the community that are already being done to then help individualize and help improve the symptoms. The other thing that I and now, because I have a son who's in his late 20s with autism, and I've been in this journey now for over 2 decades, I think there needs to be more research looking at and more, not even research, but more opportunities and interventions to help adult individuals with autism, to help them find a skill set, a vocation, something that takes their strengths and helps them find something meaningful to do in a environment where it's valued.
Yeah.
So I think after children turn 22 out of the school district, it's dismal. So I know we're talking to a population with younger kids, but I think that's also a wish of mine, is to see more opportunities for young adults.
I love that. And Tanya, and I know you share a lot of those same feelings, but anything else you would add?
Yeah, if you asked me for a wish, as a general pediatrician who is always helping parents find daycares, preschools, elementary
Yeah.
schools, and high schools, I would like to see more therapeutic schools across the country
Yes.
and
Yes.
families to have access to them where the kids can go in and get the speech therapy, the occupational therapy, and everything they need in smaller settings. There are a few schools around the country that do a really good job, but they're not everywhere. And even out in my area outside of Los Angeles, we have very few of those schools, and they're so hard to get into. Not even cost aside, there's waiting lists, right? And it's a lottery. And I think that's really what we need, because we know how important that early intervention is. And even though we need more research to figure out all the new things to do, we have a lot of things we know that work well right now, but we just can't get it to all of the kids who need it everywhere.
Wow. I love it, just because between both of those answers, we've tackled every part of the story, right? Not only understanding the why, which is what we talk about with research, and then also understanding the support that these children need. And that support comes in the way of not just medication like Leucovorin, but older adults, autistic adults, and then the younger kids. And I share that same sentiment. Of course, I care more about, I really am very interested in the research and the why. And like you said, finding actual genetic markers. Can we find out? Can we, have different sort of stratification and more understanding of, okay, this is the subtype. And that's really cool. And then for me, it's also access to early intervention, right? In Florida, where I practice right now at the time of this recording, we're like one of the bottom of the in the country for being able to get services for children. So not only in schools, but like just getting the early intervention. So you're dealing with clinicians who are not even able to be open to this situation of like, okay, how can I support my patients in other unique ways? But then you're also dealing with families who don't have the developmental resources. And we know how that impacts parenting, right? We all can understand that parenting already is hard. But I will say this, that parenting a neurodiverse child is its own degree of difficulty, right? I mean, there is normal parenting strategies will not always work with your autistic child. And when parents don't get that support, they burn out. Marriages, I've seen so many marriages end because of autism. And I'm not even like, and it breaks my heart because I know that it's because of the stress of not having support, and that is what I think we all want. And, my final question for you is, this press conference brought up a lot of feelings. Did you have any feelings from the press conference? Feelings of hope, feelings of, oh, that's not how it should be? Or what was your like initial reaction to this hour-long press conference from the president and some of the hires in our administration in terms of the autism, solutions and treatments that we have?
From my standpoint, when I heard it, I have to tell you, I think I was as a mother of a now young adult with autism. I think I was I was really angry. I think initially it saddened me.
Yeah.
I think that it 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 shed a light or highlighted the how or what perhaps a mom might have done to
Yeah.
cause the autism in their child. And I feel like I've spent over 30 years helping parents, helping moms overcome that guilt and helping them understand that no, it's not something you did or didn't do. This is the genetic salt shaker, and we don't know all the other factors that play a role in this, but it's not something you did. And so that was my initial reaction. Now over the weeks, as I've had time to think more about it and talk more about it, I think I'm feeling a little bit more hopeful that, autism is being highlighted. So that's a good thing, that we're having these discussions in terms of how important autism is, how important autism research is, how important it is to find treatments and support for our families. And so I'm hoping that this sheds a light and opens more research funding, opens more availability for that. And so I'm hopeful from that standpoint. But I'm
I
also
love that.
hoping that parents are not living in fear, because
Yeah.
I think the fear is one of the biggest factors here that we as pediatricians, it's our job to help parents feel more at ease and help partner with them to help them, help them parent. So that was my feeling.
Tanya, what about you?
So I wish we had heard it from people with more medical background or
Yeah.
experience, right? As we were listening, I thought, this doesn't really make sense. They're talking about really important things, but it doesn't make sense. And it's always bothered me that medicine and healthcare has become so politicized over the
Yeah.
last handful of years, especially since the pandemic, because we have amazing healthcare leaders and doctors and scientists and even parents who have cared for their own kids with autism. My families know more than I do, and they're not doctors, right? But I feel like we could have heard it from somebody with a little bit more caring and empathy and science behind it. So that kind of bothered me. And then I also didn't love the answer, the backlash that I knew we were going to get from both sides, right? Whatever
Yeah.
your side on, right? Then you have medical organizations saying absolutely not. Tylenol is absolutely safe. Okay, well, nothing is absolutely safe, okay? But yes, we know that nothing that they said showed that Tylenol caused autism. But let's still talk about, when you're pregnant, and everybody now that's pregnant is terrified. It reminds me of when Paul Offit talks about how people were terrified to let their kids swim in a swimming pool because of polio, right?
Yeah.
Now, moms are terrified to have babies because they're worried about autism. And I wish our approach was different in this country. I also think, unfortunately, a lot depends on the insurance system, which
Yeah.
I don't love that what so many doctors do depends on what insurance would cover and how much time insurance will let them spend with families. And honestly, I think that's what allowed me to become a better pediatrician 10 years ago when I stopped taking insurance. And again, it's not for everybody, but I can spend hours with my families now. I can fly to conferences for them. I can really research and learn about all these new things. And so I do feel guilty for the pediatricians at my old practice who have 10 minutes to see every patient because they don't have the time to do that. And every child is so unique and different. It's not a protocol.
Yeah.
And I think we need to get back to personalized, individualized medicine in our country. And I don't know how to solve that problem. I really don't. So I just try to advocate and help each patient I see.
Well, that's what you're doing. Yeah, that's what you're doing. And I mean, I'm in your realm of like I have 65% of my patients are Medicaid, the 10-minute visits, at my clinic that I'm not there every day, but I am there on Fridays. And it is hard. I mean, I agree. And I know you are now like a no insurance taking clinician, but the work that you're doing by going to the conferences, coming on my show, I mean, I want you to know that this is what it's about, right? It's using our time and our expertise and our powers to really say, okay, how can I better this for everyone? Because maybe those conferences you go to, you're now a voice on social media, Tanya, to be like, hey, this is what I'm learning and this is what I think we should know more about. And it's that advocacy piece that can reach even more voices, more ears. And I think that's awesome. But I hear what you're saying, and it is a hard reality. And I felt the same way with the conference, Anshu, like seeing it, being upset and angry of like, Tanya, you saying that why is it the president who has no knowledge in autism or in, neurodevelopment or anything related to medicine or development making the main statements? Number one. Number two is that what stigma is this creating and blame? And then after I sat with it, it was that realization that, okay, now we get to talk about this. And maybe we can have these voices like we're doing today together to be like, hey, this is what we want you to know. And I am just loving what we talked about because this is again what I'm hoping to do in medicine as well. Like you said, Tanya, is individualized care, ask the tough questions, be willing to take a risk and say, you know what? This may be off label, but let me talk to you because it's individualized care. And that's so awesome. So, I'm very grateful that you both came on today. I think we really hit a lot of areas. Of course, we could have many different conversations about screens and neurodevelopment. And I found my think tank here, and I love that. What would be your final important message you'd want parents listening or even clinicians listening to walk away with today regarding autism, research, and treatments as well?
What I'd like parents to know that, again, autism is very complex. It's not a one-stop shop. That Tylenol doesn't cause autism. That Leucovorin is not the cure.
Mhm.
I think it's important for parents and clinicians to understand how complex this disorder is, to understand the nuances, to really focus on the strengths of the child as opposed to focusing on the diagnosis. I think that's what I know I do and Tanya does, is really focus on the strengths and the challenges, and see what does the child need to be more functional, to improve on the areas that they struggle in. But then how can we help the child be as highly functional as possible in our society and have a meaningful and purposeful existence like we all deserve. That's what I would like to share.
I love that. And Tanya?
Yeah. And that is great. I mean, I would say that, I want parents to know that as a parent, they know their child best, and they really are their child's best advocate. And I know sometimes it can feel like you're up against all these barriers, but please keep advocating for your kids. Find a pediatrician. I hope everybody finds a pediatrician that they can really work with, that will spend the time with them and really help them figure some of these things out. And as Anshu said, time goes by so quickly. So don't forget to stop and, smell the flowers and enjoy the time with your child, because every child is unique and exciting and interesting and happy and curious. And it's so amazing to watch them all grow and develop.
Oh, guys, this was awesome. I, again, am just so grateful for your time. I know we're all busy here. We all are doing this work that we're talking about on this podcast episode today, and, attending the conferences, taking care of the patients, managing our communities. And it means so much that we could come together and share this innovation around what we wish the autism world can look like. Where can everyone go to stay connected? I know, Tanya, you have a social media handle, if you want to just share that. And if you want, again, where you're practicing things like that for both of you.
Definitely. So I think I'm on all forms of social media, or at least as many as I can wrap my head around, right? And it's my name. It's at Dr. Tanya Altmann, DrTanyaAltmann. My website is drtanya.com, and my practice is Calabasas Pediatrics.
Well, thank you both so much. I really appreciate your time. And for everyone tuning in, I know you learned something, because I learned something. And like I said, I love being able to have guests on my show to not only educate you, but to make me a better pediatrician. And so if you like this episode, subscribe to the channel. Make sure you share this episode, comment, and go on our social media channel. I'll be tagging Dr. Tanya Altmann as well on the post I did today for this episode, so that you can share it, comment. We want to know what you have questions about. We want to know what you're feeling, whether you are a parent of an autistic child or not. This conversation is extremely important to share. So thank you, and I cannot wait to chat with another guest next time on the show.